afternoon, everyone. Welcome to our All Recovery meeting. My name is Karen, and I'm one of your recovery coaches.
Hi, I'm Raina. I'm one of your recovery coaches here at Capital Recovery.
Good afternoon, everyone. My name is Craig. I'm also a certified recovery specialist.
Certified.
Certified. So I figure I'll put that out there, for all those who don't know, we are all certified. So what are we doing today, ladies?
We're doing addiction, cravings, symptoms, treatment, and relapse prevention.
And this article is brought to you by recovery.org. So if you ever want to get any of this material or future materials, always listen for us to give the shout out of where we got these articles from. And all right, so I'll start off, and so we're not going to drag it further. So as you can see, it says addiction, cravings, symptoms, treatment, and relapse prevention. Experiencing cravings is a normal part of the addiction recovery process. According to the National Institute on Drug Abuse, more than 85% of people in recovery relapse in the first year. That is a high number, 85%. A common reason for relapse is due to cravings, which are often response cues formerly associated with drug-taking experiences. If you or someone you care about is misusing substances or has already started the recovery process, it's helpful to learn more about cravings and how to more effectively manage them. Keep reading to answer the following questions. What is cravings? How long do cravings last? What are triggers for drug cravings? What are common alcohol and drug cravings? What is relapse prevention? How can you manage drug cravings? And the last one says, what medications are useful for cravings? And so we got a whole host of articles, and I hope anyone that's watching this, if you or any of your loved ones are struggling with substance use disorder, please utilize information or contact our office. All right, and so we're here until 8 p.m. tonight. Someone will be here. I won't be here. I don't know who ain't gonna be here, but I won't be.
I won't be here.
Oh, okay. Let me log on. So without further ado, we're gonna keep on moving. I'll read this and then we'll take turn.
Sounds good.
Because this is a lot right here. So we're going to get right into it. What are alcohol and drug cravings? Drug or alcohol cravings are intent desires to use drugs or alcohol, which trigger an urge or intent to use alcohol or drugs. Cravings can be so strong that it's difficult for a person to focus on or think about anything else but satisfying the urge to use the substance. It says triggers. Let's say craving can be so strong that it's difficult for a person to focus on or think about anything else but satisfying the urge. All right. Cravings are a symptom of substance use disorder as outlined by the American Psychiatric Association, APA, Diagnostic and Statistic Manual of Mental Disorder. DSM-5 criteria for substance use disorder, which is also known as SUDS. The APA explains that cravings can occur at any time, but they are more likely to occur if you are in an environment where you use to use or obtain the substance. And so craving is more heightened if you are in a familiar place where you once used or where you want to purchase the drugs at. And so be mindful, because a lot of times people don't understand certain cues, and certain cues can be stimuli. Stimuli can trigger one behavior to indulge or relapse if they're not, right?
Sorry, go ahead.
No, go ahead.
I'll say that's why I always say, like, to change, like, people, places, and things.
Absolutely.
Because I'll definitely start making you feel that again.
Absolutely. Cravings can be difficult to withstand for people who have a substance use disorder, partly due to the way many addictive substances work in the reward center of the brain. Dopamine is one of the neurotransmitters in the brain associated with reward, motivation, and reinforcement, and repeating pleasurable activities. All right, it says dopamine, right, is one of the neurotransmitters. It is naturally released in response to pleasurable activities like eating or sexual activity. When a person takes drugs or alcohol, the brain's reward circuit is activated, resulting in abnormally large amounts of dopamine. This release helps to reinforce the desire to use the substance. I always wondered why, when people, well, let me use me. When I was using drugs, I thought I was having such pleasurable good time. I thought I was just being happy. I was, excited. Oh man, party, party. But not knowing that I was just actually numbing myself with these very addictive substances, whether it be alcohol or drugs. And so now I understand that it's come from the dopamine that's naturally already in our brains. So,
Yep.
So some scientific information today. So we're not scholars, but we're going to give you some scientific information. When a person takes drugs or alcohol, the brain's reward circuit is activated. I think I read this already, resulting in normally large amount of dopamine. This release helps to reinforce the desire to use the substance. Over time, this release, when using a substance, will cement the connection between the substance and external cues or triggers related to using. Cues can be things like the environment you use to use drugs and people you use substance with, drug paraphernalia, or certain physical sensation. So the article says there is external cues that can bring about these desires to reward yourself with substances or drugs, put it like that.
There it is again, and people, places, and thing. Environment, people, and then substance.
And substance.
Yep.
When a person stops using a substance and goes into a withdrawal phase, they can experience craving symptoms. After the body has adapted to the presence of the drug or alcohol, it may be difficult for a person to experience feelings of pleasure from anything else. Wow. That's some good information there. Many people may relapse because the desire to experience pleasure again and get relief from uncomfortable withdrawal symptoms is so great.
Yep.
And so that's why when they, a lot of times when we read or we be in programs or treatment program, they talk about boredom. Boredom is one of the key factors that cause a person to relapse. Because as the article says, what it says, after the body has adapted to the presence of the drug or alcohol, it may be difficult for a person to experience feelings of pleasure from anything else. And so we're so accustomed of using drugs that our body or things we don't really know how to enjoy life without having certain coping skills. And so when boredom comes along, we turn or revert back to using drugs. That's a sad connotation, but that is a reality of so many. As we read earlier in this article, it says 85% of people have relapsed due to triggers and cravings and urges. All right, somebody else want to read?
Sure. How long do cravings last? The amount of time a person can experience drug cravings varies depending on several factors. Someone who has a substance use disorder may experience cravings while using substances during withdrawal and after withdrawal and treatment. The APA points out that cravings can occur at any time, And NIDA says that people can experience cravings even if they haven't used the substance in years. That is very true.
Mhm.
I still find like once in a while it's fleeting, but like that it'll come and then I'm like, oh no, you gotta go.
Yeah.
Treatment for substance use disorders typically includes an element of relapse prevention, where a person learns to identify and manage cravings and cues that precede cravings. For some misused substances, medications may be used to assist in reducing, minimizing, or eliminating cravings.
Wow. So basically, it's to the point where when a person needs medication, to the point where it's very hard for them to cope or deal with the thought.
Mm-hmm.
And so they need these added vices to eliminate some of these cravings. So
Yeah, I remember when I first got clean, I had post-acute withdrawal really bad, which means I had withdrawal symptoms for several months. Yeah. Where typically it's like a couple of weeks, a few weeks, I had it for an extended period of time. And like they said, like that in that beginning, like I wanted to go out and use like every day because of it. And I finally got in to see like mental health professionals and whatnot, and found the Vivitrol shot like stopped it like that.
Oh, okay. Yeah, I heard about that shot.
Yeah, and it's not addictive, and like it just gave me that little buffer to make sure it was gone, so I can continue without having that constant feeling.
So
Yeah.
let me ask you something, because I'm not aware too much about Vivitrol. Vivitrol, I think it's lasts for 28 days.
Yeah.
And so what is the normalcy or the normal rate a person have to be on Vivitrol?
They usually recommend like 6 months.
6 months?
Yeah, and like I said, that like you can stop at any time. I actually was on the pill version.
Okay.
Because then the Vivitrol shot there was no place around here that did it. But yeah, like it was like a couple months. I did, yeah, just to like give me that buffer and not have that constant.
Then you be on your own after that.
Yep.
No problem.
Yep. Gave me like some time to get established in the recovery world and
meet new friends,
new
new places,
things.
try some new things. All right, so that was great. That was some good information. What's next?
What triggers drug cravings? So exposure to places, people, or things that are associated with using the substance or that remind you of using the substance can trigger cravings. So it's kind of like, the way I think about it is, because I haven't experienced it myself, but I think about it like a memory. You know how some some songs or some scents bring you back to a certain memory?
Absolutely.
Yeah.
Is how I would understand cravings.
Yeah, I'll get like like a smell, and I'll be like that little flashback real quick. Yeah, that's exactly like kind of how it is. Yeah.
Cues that trigger cravings and may threaten sobriety are often common in everyday situations, such as going to the neighborhood where you bought or used drugs or alcohol, seeing people selling drugs or alcohol, going to a bar, associating with people or friends who drink or use drugs, having just one sip of alcohol, smelling the substance, psychological stress, relationship problems, work problems, chronic pain or pain associated with medical issues, co-occurring psychiatric disorders, encountering objects associated with past drug use, seeing drug or alcohol use in the media.
It's a pretty good list.
Yeah, and I was, as Karen was reading, I was thinking to myself, I said, I experienced at least 4 or 5 of these bullet points that she read, especially when it says seeing people selling drugs or alcohol, going to a bar, smelling the substance. When I used to smoke marijuana, that would be like a trigger or craving for me at that time. Work problems. If I had a bad day at work, it was too strenuous or stressful, a long commute, I would reward myself because it talks about the dopamine, the reward sensors. I reward myself with either marijuana joint or alcoholic beverage.
Mhm.
And so I know they don't call them joints now. I'm telling my age, but you can see I'm an old timer. But anyway,
Still applies.
it still applies. Smoking marijuana, whether it's a joint or I don't know whatever blunt or whatever else they're using nowadays. But it was at least four or five of these bullet points that applied to me when I was in my state of addiction.
Yeah, I was gonna say in like my experience too, I've noticed that some of these seem to be more problematic than others. You know what I mean? Like relationship problems, I've seen be a huge one when it comes to relapse and that sort of thing. Or like still associated with friends who drink or use drugs. It's like that old adage, you sit in a barbershop long enough, you're gonna get a haircut. Yeah, it's the same kind of thing.
Absolutely.
And I think sometimes too, depending on where you are in your recovery, like some things you'll notice won't bother you so much. You know, like we went and did the knock and talk, and I'm like, yep, I used to buy drugs in that house right there. And it didn't bother me. Now, if I did that a couple years ago, it would have been a different story. Like I avoided I avoided different places. Now I'm just like, yeah, that's what it was.
Mm-hmm.
You know what I mean?
So there's a difference from an early stage of recovery and then a long.
I think it depends on like how plugged in you are too, because I use an example of a friend of mine who had passed. I was trying to get her help, and I was at her house, and I found a very large bag of Xanax.
Mm-hmm.
And it was earlier in my recovery, and I was taught to call somebody, and that's exactly what I did. I picked up the phone, I called somebody, they walked me through it to make sure, you know what I mean, everything was okay. But if I didn't have that, there's a good chance it would have gone in my pocket, and I would have been out using again like that.
Off to the races.
Yep. Yeah. So there's things you can put in place to help you overcome these.
So the next part of the article we want to read is common drug and alcohol cravings. Being familiar with cravings and the cues that precede or triggers cravings can empower you to take action to prevent relapse. Craving drugs or alcohol can include physical urges to use the substance, strong intrusive thoughts about the substance, a desire to use the substance so badly that you can't do or think about anything else, significant distress when you think about the substance. All right, and so those are common drug or alcohol cravings. And so the article talks about physical urges, intrusive thoughts where out of the blue, you have these thoughts that you weren't even thinking about, a drug or a drink, and now all of a sudden you have these fleeting thoughts. I call them fleeting thoughts because they don't last long. If you have the right coping skills, you can dismiss them. But if you don't, please seek some type of help with whether counselor, therapist, sponsor. You can even contact one of us.
Absolutely. Come in and tell us about it.
Tell on it.
Yep. So going to the next one, we're with cravings for specific drugs. All right, so cravings can occur if you are dependent on a substance and stop using it, and can peak in intensity at certain points during the day or week. Specific drug cravings can vary by onset and duration. Cravings can occur with many substances, including cravings and relapse prevention.
Oh, I think it was deleted or something.
I was gonna say, wait a minute, so we're just gonna move on to cravings and relapse prevention. I'm like, wait a minute.
Go with the flow, huh?
Yeah, all right, so addiction is a chronic long-term condition that requires lifelong management. Lifelong management. If you think you have arrived, you have not. If you think you're good, you might want to like buckle down a little bit more. It's a lifelong process.
There's a saying that says, if you think you have, like you said, arrived, you think you have reached the pinnacle of your recovery, that's when you begin to descend. because, it's a lifelong, because it's more than using alcohol and drugs. There's other behaviors that come with the
Yeah.
addiction.
Absolutely.
So,
So while you likely will never eliminate cravings, you can take steps to recognize what trigger cravings and learn strategies to manage them and prevent a relapse. Like, so we drove by the house where I used to buy drugs, I just go down the street before instead of going down that street. Like something simple can actually make a really big impact. Relapse prevention strategies can involve using skills that you learned during treatment or those that you continue developing as a part of a continuing care plan. Continuing care may include mutual help groups like Alcoholics Anonymous or Smart Recovery programs, therapy, or other services, such as what we do here at the center. Like that's what we're here for, to help you on your journey and continue, to develop the recovery.
Support group.
Mm-hmm. Receiving proper treatment, which may include medication that helps reduce or eliminate cravings, as well as ongoing support and aftercare, can be a beneficial way to deal with cravings and remain clean and sober. I think that ongoing support and aftercare are key.
Yeah.
To continuing, to stay clean and, continue on your journey in recovery.
I often tell the story that I was in a therapeutic community, whereas I was among a peer group. That was through the Department of Correction. I was able to receive some type of treatment, some good treatment, not some type of treatment. I received some good treatment. And so after completing the program, the treatment program, I thought I was done. So it was like a 15-month program. I'm like, okay, I'm good. I got my certificate. And so just before I was leaving the program, I had to see my case manager. And so she goes over my treatment plan. So she says, here's your treatment plan as a continuum of care. This article talked about aftercare, but they told me continuum care. I said, you mean tell me I got to do more treatment? I thought I was done and healed. They said, no, you still have to keep going through the process. And so I learned early on, but back then I learned that it benefited me. I think because as each program that I attended, I was able to be successful with it because it began to become almost like natural. Because at first when I started doing therapeutic programs and groups and speaking and teaching, facilitating groups, it was like foreign. I never knew what it was. I'm like, what is they talking about? But eventually, just like anything else, you do it long enough, you get familiar with the process.
Yep. It was a habit. Like we talk about in 12 steps, doing a 90 and 90 because it takes 90 days to develop a habit. So you get used to it, and then it just seems like, okay, it gets easier and easier and easier.
Yep.
All right, so the next one is addiction treatment for drug and alcohol cravings. One size doesn't fit all when it comes to addiction treatment. Individualized treatment is important for optimizing your chances of long-term recovery. It takes into account many of the concerns that can impact addiction and recovery, including your medical, psychological, social, vocational, and legal problems, as well as other factors such as your ethnicity, gender, age, and culture.
Yeah, I think, I've noticed too, a lot of people who, are in active addiction often suffer from some kind of psychological or mental health disorder. And it's very important to treat both of them. Like for me, being in recovery and doing a 12-step program is helped me immensely, but they're not a psychiatrist. They're not a therapist. You know what I mean? So I have to address those issues as well to get that overall care that I need. So that's very important. And these are things that we here can help. You know what I mean? Help with finding employment, put you in the right direction if you've got some other issues going on. Because you got to treat everything, not just like one. That's only one little piece of it.
Yeah, it's good that you mentioned the psychological aspect of dual diagnosis, because a lot of times most people who experience substance use disorder only think that that's the only issue that they are faced with.
Right.
But come to learn now further through reading and groups that most people that suffer from substance use disorder also suffer through some type of post-traumatic stress disorder,
Some trauma, yeah.
some type of trauma, and that is like the deep-rooted aspect of why people utilize drug, or what they call masking. And so there's a co-current aspect to a lot of people who have this disease of addiction. So
Yeah, and I noticed when I was putting together like the resource guide for like treatment centers and stuff, I see a lot more of them listed as dual diagnostic than what used to be. So like, the treatment centers are realizing that's an issue as well.
absolutely.
Common treatments and supports for addiction include detox. For many people, this can be the first step in the recovery process.
The first step, not the only one. Okay, go ahead.
It consists of a set of interventions designed to help you stop using the substance, stay safe and comfortable while your body undergoes withdrawal, and prepare you for further treatment.
And I say that first step because I tried just doing that several times.
I think a lot of people try that.
It's like
Yeah,
kind of like
yeah.
getting a little tune up and going home, and yeah,
I'm curious.
yeah. There's
You feel good for a little bit and then right back.
yep.
Inpatient or residential rehab, which is you live on site at a facility for the duration of treatment. You receive 24/7 care and support and participate in different treatments. Outpatient treatment, you live at home but travel to a treatment facility 1 or more times per week. Outpatient can occur on varying levels of intensity.
And I feel that like this is like a step 1, step 2, step 3, what you just read. Like you do your detox, you do your residential, you do your outpatient, and then keep going.
You have to also make time for that outpatient.
Oh,
I hear
Yeah.
a lot of individuals say they can't do outpatient or they can't go to meetings because they have work.
they got work,
Time.
or I got to
Found
get the
plenty of time to
kids.
go get drugs.
Yeah.
Dual diagnosis treatment. It is addressing co-occurring psychiatric conditions like depression or anxiety is important because they can impact cravings and your overall recovery
That's what we were
process.
just saying.
Recovery success. Support groups, which is receiving mutual support from others who know what it's like to be in your shoes and can help you remain sober. What we are.
Yep, absolutely.
Recovery is an ongoing process that doesn't end once you complete formal treatment. Continuing care for drug and alcohol disorders can help you avoid relapse, maintain abstinence, and support long-term recovery. Continuing care may involve many different methods, such as participating in self-help groups, such as AA or NA, engaging in individual or group therapy, living in supportive housing, such as sober living homes, engaging in self-care, such as exercise and mind-body relaxation techniques.
And if you ask me, it's all of the above.
Yes,
I
a little bit of
remember.
everything.
Yep. Or my stepdad being like, "You gotta go to those things every night." I said, "I got high every night." So yes. And then, you know what I mean? I did, group therapy and, living in a home with not super living, but a clean household, engaging in self-care. They're all like, it's like, again, that well-rounded recovery makes you more successful.
American Addiction Centers maintains a strong partnership with a large group of insurance companies. Oh, that's advertising their recovery.
That was the one that should have been deleted.
Start your journey to recovery by contacting us.
All right, and so we're gonna talk about one of the ones we were making mention of is deal with medication for cravings. And so we was talking about what is it? Vivitrol?
Yeah.
Vivitrol earlier, and so let's see what the article talks about when it comes to medication for craving. People being treated for a substance use disorder can benefit from recognizing cravings and the cues that precede them. Behavioral therapy is commonly used to help identify craving, cues, and triggers. For some substance use disorders, medication can be used to help reduce cravings, which may help you remain abstinent. There are currently no FDA-approved medications to treat addiction to cannabis or stimulant like cocaine or methamphetamine. However, there are medications used to treat alcohol use disorder and opioid use disorder that can help reduce or prevent craving. These medications include 2 of the 3 medications that are FDA approved to reduce craving for those with alcohol use disorder are Ancamtrosate. If I'm pronouncing it wrong, charge it to my head, not my heart. May have some anti-craving properties and is typically used to help a person who is already abstaining from alcohol remain abstinent. Naproxen may help reduce cravings over time by blocking the pleasurable effects of alcohol. Disulfiram does not help to reduce craving, but if you do relapse, it induces unpleasant symptoms that may make you less likely to continue drinking.
I remember years and years and years ago, I had a friend, and we weren't long out of high school, who had, he was addicted to heroin. And we were at the house one day hanging out with his brother, and we could hear him screaming and crying. And we're like, what is going on? He's like, oh, he's on that medication, and when he uses, this is what happens. It was intense.
Making them want to use, huh?
I lost track of him a while ago, but yeah, that was my first. I had never heard of anything like that before.
Yeah.
And I'm not familiar with that Ancamtrosate
Yeah, a lot of stuff.
one either. The naltrexone is the Vivitrol.
Okay.
Yeah, that's like the pill version. That's what yeah.
Good to know.
Yeah.
The more you learn.
Yeah, because even though we're in this field, we don't know it all. We don't proclaim to know it all, but it's always good to
Always learning.
learn something new to better one's health. All right. The 3 medications FDA approved for opioid use disorder are each effective at decreasing cravings for opioids.
Suboxone. We're just
Suboxone.
gonna go with Suboxone.
We're gonna say Suboxone or methadone. Let's leave it at that.
Yeah, a lot easier.
Tongue twister. All right. Can reduce craving for opioids during withdrawal management, post detox, during rehab treatment, and as part of an aftercare plan. And so, oftentimes here at Capital Recovery Center, we come across people who are under some of these medications, and one of them is Suboxone and methadone, and we oftentimes help them either find a facility that assists them, or if they're on a medication assisted treatment and it is too high, we still will look around to find a place that would accept them. Because sometimes we meet people and their doses might be 135 milligrams. And unfortunately, some of these facilities will not accept them under that high dosage. So it's recommended that they speak with their physician or whoever prescribing to try to reduce it without harming them.
And also, like if this is something that you feel would help you with your recovery, we can also, put you in contact with one of the outpatient programs that can help you get set up for that.
And the last one talks about naproxen, blocks the effects of opioids and can be used following withdrawal from opioids as part of a long-term care plan for managing opioid use disorder. Right?
Yep. And the last one, support and therapy for cravings. Managing cravings usually requires a multifaceted approach to help prevent relapse, which is basically what we've been saying. Like, all of these things individually are helpful, but as a whole, you're going to get the best results. Behavioral therapies, support groups, and other forms of treatment can help a person overcome cravings, reduce the risk of relapse, and help to deal with relapse if it should occur. A few common therapies and forms of support that can help manage cravings include cognitive behavioral therapy. This can take place in groups or on an individual basis. CBT teaches you ways to manage cravings and develop healthier stress management and coping skills so you can avoid relapse. Contingency management. This is a form of treatment based on positive reinforcement. You receive rewards or tangible goods in exchange for positive behaviors so that you are motivated to remain abstinent. Why do I feel like I just read like How to Train Your Dog? There's your bone. But no, I mean, I understand what it's saying. It's like the same concept, like when you're a kid. If you do a great job and you get like a little gold star, you want to feel like, okay, I'm doing what I'm supposed to be doing, and it's recognized, and it's still encouragement.
Yeah,
do you guys still do you guys still give chips for like AA meetings?
Mm-hmm. Yep.
Apple.
Tags for NA.
Yeah.
Yeah, just got my 4-year-old.
Oh, congratulations.
So that's that right there. It's what it is. Yeah. It's a very good example.
Those 2 bullets that you read, I believe that will help me when I was in therapeutic community a great deal. CBT, it was called it was called CRP, cognitive restructuring process. That was one of the techniques or information therapy that they utilized when I was going through therapeutic, and contingency management, positive reinforcement, rewarding, changing negative thoughts with positive thoughts.
Yep.
Yeah. Good stuff. Really, really, really good stuff.
Yeah. So then the next one is mutual support groups. These groups can include 12-step groups like AA or NA, or non-12-step groups like Smart Recovery. By receiving support from others who are also in recovery and learning strategies to deal with cravings, you may be able to maintain your resolve to avoid substances and overcome cravings. I find that having a support system is so important for so many different reasons. If you're going through somebody, usually when you're in one of these programs, you can find somebody who's been through it to help you through it. So it's very important to have a group of people that are there to catch you if you start to teeter.
Absolutely.
What else? Mindfulness-based relapse prevention. Learning mindfulness skills can help you ride the wave of cravings and help you maintain a non-judgmental, accepting attitude throughout your recovery journey. That's interesting because that kind of goes like being open-minded and you know what I mean, like
especially non-judgmental.
Yeah.
That's the aspect of having self-compassion.
Yeah. Absolutely.
So understanding that humans are flawed, everyone.
Next one's distraction strategies or therapies, such as music therapy or art therapy. Receiving music or art therapy in a group with others can serve as a helpful way to temporarily relieve cravings and manage addiction.
And that is part of behavioral modification. They teach you desensitization techniques, breathing techniques. It's very helpful. Here also they have art therapy, and that's so beneficial to a lot of people when they are in an environment where they never, say for an inner city person who only thing they ever seen was train, buses, concrete buildings. But when they get the opportunity to go outside of their normal environment, go to somewhere where you can go fishing, you can go up in the mountains,
being quiet and
trail.
Yeah,
That is something
soothing.
that's very good.
I've never had like formal music or art therapy, but I use both of those things as coping skills. Like being in the car by myself, like the ride home just to decompress, the music's up, you know what I mean? Or like both Karen and I were always like, I'm drawing and she's over there painting today. And so those things are good to like, you know, keep your hands busy and your mind, you know, focused. And the last one is stress management techniques like yoga, which if you would like to come in, you can use my office. We have yoga mats. It is the meditation room. I will happily let you decompress in there. Stress can play a role in cravings and relapse. So managing your stress can be a helpful way to remain sober. Different methods work for everyone. But one study showed that yoga can be helpful for cravings and overcoming triggers for relapse. And it says here, although dealing with cravings isn't easy, it is possible to recognize the cues that precede cravings and overcome relapse triggers. Addiction treatment can help you develop the skills you'll need to remain sober and manage cravings.
Wow.
That was a really good article.
Pretty good article. And we did it less than an hour. So
Lots of good info.
it's always good to be here to share some good information. Please let someone know what we're doing here, and I'll see you next time.
Thanks.